Good evening. Good evening, everyone, and welcome to ATP Live Monday. I hope you can hear me. You can see me for those on Facebook, Instagram, and YouTube. And for those on ATP on live audio, hope you can hear me. And if you're also watching the recording on the podcast, I hope you can hear me as well. So I just want to welcome everybody, whether you can hear, whether you can see, or whether you can hear and see me at the same time. Welcome to ATP Live Monday. So ATP Live stands for Ask the Pediatricians Live. So my name is Gbemisola Boyede. I'm a pediatrician, founder, CEO of Ask the Pediatricians Foundation. And I'm here today to answer any questions that you may have on your children's health issues, hopefully in the next 1 hour. So if you have any question, feel free to for those of you on Facebook, you can put it straight under the comments on the video. If you're watching on the page or on our Facebook group, but if you're watching on another group that the link has been shared, then you have to click on the video so you're able to put in your question for me to see. And for those of you on audio, you can drop it in the comments. For those on Instagram, you can drop your questions in comments. For those on YouTube, you can drop it in comments. So what I'm going to do is to try and answer as many questions as I can, hopefully in the next 1 hour. So before we start, can I kindly seek your indulgence to share the video, to invite your friends and family, anyone you know should benefit from this program, please invite them now. And I also want to let you know that all the recordings of ATP Live are available even after the program. You can always watch them on YouTube. You can listen to them on my podcast, and you can watch them on our Facebook as well. So even on our Instagram, IGTV on Instagram, you can always watch all our program. So welcome everybody. For the next few minutes, I'm just quickly going to share the video. Make sure that everybody else can see and can hear me. So if you're also watching, you can also please share the video, and please let's tell people to join us so that nobody's going to miss ATP Live. So while we're doing that, in the next 2 minutes, please, you can be dropping your questions on whichever platform you're watching from. So I'm just sharing to our other group, and so that they can also watch it. But please share it as well. Share. Let's share it widely. Let's get as many people watching ATP Live, and you can invite people to join us as well. Okay, so I'm just sharing, and then after that we can start. But please start asking your questions already in comments so that we have enough time to answer all the questions. And I'm still sharing. Okay, I'm going to share to our other group. So welcome everybody. Welcome to ATP Live. If you are just joining us, we're about to start, and we're only just sharing our videos to the rightful places to make sure as many people as possible can watch. And if you have any question, please drop your questions now on whichever platform you're watching from, and I'll try as much as possible to answer as many questions as I can in the next 1 hour. Okay, so please share. And welcome everybody. Welcome. Just 1 moment. I'm still sharing. I know there's so many places to share to. I just want to make sure everybody can see and everybody can watch. Okay, and finally, I need to make sure that the videos are pinned on our Facebook groups so that people can see it. And I can see those of you that are listening to me on on it on my audio, my live audio room. Thank you so much for joining me. Okay, I think somebody has helped me to share the video to. I think the video has been shared, it's been pinned. Okay, so all right, thank you so much. Somebody has pinned it for me in the. Let me just be sure it's pinned in the other groups as well, so that everybody can see it. And happy Mother's Day in arrears to all the mothers. Well, it's just a day, it was yesterday, so I think it's still a good time to say happy Mother's Day to you all. We celebrate you. We thank you so much for everything you do for our children. Thank you. Okay, I think somebody has helped me to pin. Let me pin it again. Okay. So happy Mother's Day to you all. And thank you for all that you do for our children. On behalf of all the children, I'm the one saying thank you, because we pediatricians, we love mothers. We can't do without you. You are our partner in progress. And thank you so much. So we just want to appreciate you. We are the advocates for the children. We're their mouthpiece. And so we want to say thank you on behalf of all our children, to all the mothers. We appreciate you. We love you. Thank you so much for taking good care of us. And thank you so much for everything you do for us. We appreciate you. Okay, I think we've done all the sharing. We are ready to start. Let me start by saying this program, ATP Live, happens every Monday at 6 p.m. on all ATP social media platforms, on our Facebook, YouTube, Instagram, live audio, podcast, everywhere you can listen to ATP Live. And but it's just for 1 hour. If you have any questions on your children's health issues, please join our Facebook group, Ask the Pediatricians. We answer your questions from Mondays to Saturdays. So you can always ask your questions even beyond this hour. So feel free to join our Facebook group. It's completely free. And our passion on Ask the Pediatricians Foundation is to reduce deaths of children that are rooted in ignorance and that are largely preventable. And so we do that through health education, information online. We do community medical outreaches. So please support us to get this vision of where there'll be no death from preventable causes in Nigeria, in Africa, and even in the entire world. So feel free to join us every Monday, and feel free to join our Facebook groups to ask your questions. We have 3 groups. We have Ask the Pediatricians, the main group. We have ATP Family for adult health issues. And we have ATP Still a Mom, where we support mothers who have suffered any form of losses, pregnancy, or of a child. We provide emotional support for them. So feel free to join the group that best meets your needs. If you want to have a private chat with our pediatricians, you can do that through our WhatsApp number and through our ATP clinics. So ATP clinic is available for you to meet with any of our professionals at moderate fees. That is not free. It's something you have to pay for. And also follow us on all our social media platforms and support our medical outreaches. And right now we are happy that coronavirus is over and we are finally going back to the field. And so we're going to be doing our first major outreach since 2019. Oh my goodness, 2 years of no medical outreaches. We've done school outreaches, but we've not done the typical ATP community medical outreaches we are going to do in May and June. And so please feel free to support us. You can volunteer, you can donate financially, you can support us in any way. So just watch out for our flyers. And if you have any organization that wants to partner with us, we welcome collaborations to reach. Our goal is to reach children that are indigent, that are not likely going to hear about their health on social media. So we go to those kind of communities to do free community medical outreaches to them. So please feel free to support us, and we'll be happy as you do. So thank you so much. Okay, I'm done with all my announcements, and I'm going to go now straight to answering your questions. So let me start with Instagram. Instagram family, any question? Yes, I can see some question on Instagram. Okay, thank you, Gbemisola. So you can hear me. Thank you so much, everybody who has joined. Okay, the first question from Pearlicious360 on Instagram. Say, good evening, Doc. My younger daughter has mumps. How can I help ease her pain? Okay, please, when you're asking questions, always tell us the age of your child. It's so important to the pediatrician that we know which age we are addressing. Okay, so mumps is a viral infection. It's one of those infections that they don't have any specific drug treatments. It tends to run its course, usually over a couple of weeks, and it will go away. It can cause swelling of the jaw and pain. So what you need to do is to give lots of water, give painkillers as well. And if you think the child is having any other symptoms, because there can be complications of mumps as well, like abdominal pain and all those kind of things, then you may need to go to the hospital to see any of my colleagues for further management. But most children will just have mumps and it will run away, and that is it. Okay, thank you so much. I can see Dr. Vera James joining us there. All right, Sonia, saying what causes viral pneumonia in a 12-month-old. Okay, so Tonya, you've already answered your question. You say it's a viral pneumonia. So what viral means is that pneumonia is caused by a virus. That is just what it means. So pneumonia is infection of the lungs tissue. So, we all breathe with our lungs. So if there's any infection inside that lungs, we call it pneumonia. And it can be caused by different kind of germs. So we have viruses, bacteria, fungi, all kind of germs, So if you remember our biology, but viruses also can cause pneumonia. So when pneumonia is caused by a virus, we call it viral pneumonia. There are different kind of viruses as well that can cause pneumonia, but that is what caused it. So I hope that is what you are asking. The question is, how did the virus get into the child's lungs? So anything that reduces immune system, anything that causes irritation along the throat, and if somebody else already has a viral infection and is coughing, even things like COVID, for example, can cause pneumonia. So the other person, when the virus gets into the lungs and the body immune system is not able to deal with the virus on time, then it can cause infection within the lungs, and that can lead to pneumonia. So the most important thing is to prevent it from happening in the first instance. And once it's happened, it can be treated anyway. I hope that is what you want to ask. If not, you can always clarify. Let me go to the next question. Okay, Pralisha, say your daughter is 2 years old. Okay, thank you. So I've answered the question about moms. Okay, so that is good. I don't think I have any question on audio. I'll just go straight to Facebook, where majority of the questions are. Thank you so much, everybody, for joining us. Ronke, Akinsoya, Adiola, thank you. Gina, thank you. Okay, the first question is from Kola Wale Adone. Say, well done, Ma. My baby of 4 days old has jaundice. Bilirubin is 9.5. Conjugated is 1.1. Hope the result is okay. Yeah, the result is not worrisome. Okay, so but we still need to check it. So this is 4 days old. 9.5 level of jaundice. We will call it what we will still call it physiological jaundice. So, but we need to check it again because jaundice can rise. So it can often rise before it will come down. And we are not worried at the lower level, but we're worried if it starts going up. And especially if it goes so high to the level that can cause brain damage. So you need to repeat this level again, maybe tomorrow, and maybe another, and you repeat it again. So if you repeat it tomorrow and it's lower than today's zone, then we are happier because that means it's coming down. But if it keeps going up, we keep on checking it as well. And usually, if it is going to above 12 level, most pediatricians will want to start intervening, because when we talk about physiological jaundice, it should start reduce. It should not go beyond 12 maximum. So but we still need to keep an eye. That's just the important thing. All right. Ronke say, I have a question already. Okay, go ahead. Your question is, your 23-month-old is not yet talking, but understand when you speak, and it's not tongue-tied, but leads you to whatever he wants, like food and water, but not talking or calling any name. Should I be worried? The answer to that question is yes. I am definitely going to be concerned about a 2-year-old who has no words and a 2-year-old who is using your hands to communicate. That is what we talk. So when your child drags you by hand, we say that is using your hands to communicate. So this child definitely needs to see. I would say start with seeing a speech therapist. And you can also do a screening online. We call it MCHAT screening. We need to screen out autism, and so that's very important. So you can do that online. It will tell you whatever your child scored. It will tell you whether you should see us or whether you should not. You should relax. Maybe it's just speech delay and all that. So a speech therapist first, and then you can now see a developmental pediatrician after, depending on what other signs the speech therapist is picking up. Okay, let me remove these other comments. All right. Okay, so let's go back. So just to clarify for those who may want to know, I always give what I call the rule of the thumb: 1, 2, 3. A 1-year-old should have at least one word. A 2-year-old should be combining 2 words together to form phrases. A 3-year-old should be speaking in 3-word sentences. A 4-year-old should be talking like an adult, should be talking with correct grammar, tenses, everything, adjectives and all that. So if your child depending on the age of the child is not doing what is expected for their age in terms of speech milestones, please see a pediatrician. The earlier, the better. You can see a speech therapist as well. So the earlier we know what is going on. Some children just have speech delay, and speech therapy is all they need. Some children have more than speech delay, and they may have all the developmental issues that we need to address. So it is important to know which one is going on with the child. All right, so I hope that's helpful. Then let's go to Gina. Gina said, my daughter does not like to eat anything apart from breastfeeding. How old is your daughter? She's 13 months old. Okay, she's been like this after EBF. We fight. I want to feed her. She cry anytime she sees food. Okay, so Gina's question is one of the most frequently asked questions by the pediatrician. Gina, what is the weight of your child now? I really always want to know the weight, but really your 13-month-old should be eating more than breast milk. Your 13-month-old should be on complementary feeding. And I actually did a podcast on infant feeding the first 1,000 days because it's one of the things parents struggle with. And I think you may want to listen to that podcast because I think it's a long answer. Number one, it is not exclusive breastfeeding that's not making your baby to eat. We need to understand how to go about complementary feeding. There are principles behind it. And sometimes when we don't get it right at that beginning phase, sometimes it becomes children, they begin to develop what we call food aversion. So they don't want to eat and all that. But that notwithstanding, we still need to go back. Number one, you need to have lots of patience when you're introducing new food. Most parents are always too much in a hurry to, when you're giving new food, to say your child doesn't want the food. You need to be patient. Sometimes it's okay for the child to take just 1 spoon that day, and that's the only thing the child would take. Then the next time let's increase it to 2 or 3 spoons. So that is how you do it. So you don't give food once and then you say, oh, the child doesn't want it, and then you run away. Then what kind of food are you giving? How are you making the food? What's the color like? What's the gesture like? How do you present the food? So there are many aspects of that. So I really think you may want, number one, listen to my podcast on complementary feeding. Make sure you're doing it right. If you go to our Facebook group, we have guide section. We have a whole guide on complementary feeding that has videos that you can watch, what to give, how often to give, how to mix it together, all those information. You can also get you can go through the guide section as well, and then you can also get, I have a course on it on complementary feeding as well. You can also get that as well. I think if you just want to go first back to basics and figure out what we're doing and start all over again, and then make sure we do it right. Some children are fussy, but even with fussy children, they're not going to starve, so they're still going to eat, so that they may not eat as much variety, but we still need to make sure at least they are eating something, because breast milk alone is not sufficient for a 13-month-old, and that is a recipe for malnutrition if we don't deal with it quickly. All right. I hope that's helpful, Gina. It's a long answer, but I think if you check my podcast, it's on Spotify, it's on most of the podcast platform. Just Google Ask Dr. Gbemi ATP complementary feeding, infant feeding, you will get it. I think that will be helpful. Then Roslyn is saying, what can be done to a baby of 2 months who has not put for 6 days? She's on exclusive breastfeeding. Okay, thank you so much for asking that question. Nothing should be done for that baby because babies on exclusive breastfeeding may not pass stools for days, and there's absolutely nothing wrong with that. It is completely normal. And when eventually they pass the stools will be completely soft, not hard, thick, pasty, but never hard. And so there's really nothing for you to do. Just keep breastfeeding exclusively. So that's for FTM. FTM, I need to remind you of the FTM companion book. You should get that as well. All these questions have been answered. And there's also FTM 500 questions, frequently asked questions. You can also get that. All these questions have been well answered in that book, and so I recommend it. I have tried to give my quadruplets. Okay, Rosemary, welcome. Mama quadruplets, I remember you now. I've given my quadruplets solid food, but they are not cooperating. The girls go mainly on tea. See, this is why I'm trying to say that our whole approach sometimes is a problem. Number one, your baby should not be on tea. Why babies take pap? No, so that is tea and pap are not complementary feeding. Okay, so they take small quantities of rice, beans, jams, potato. That is good. They are 18 months old. Oh, they are big now. Okay, so we need to know, number one, you need to know what to give your baby. Sometimes some of us tend to rely on things like pap and teas and all that. No, we need to make sure we give variety. You need to give variety. And like I was trying to tell Kina earlier, you need to be patient. Okay, that is one thing that most parents are not. I can imagine with 4 babies, patience is going to be a whole lot of work, but I'm sure you have help, people helping you. So you need to be patient when you are giving food. You also need to know what is the quantity. Then sometimes the issue is not that the children are not eating. The issue is that our expectation as parents in terms of what quantity they should be finishing is actually wrong. So people are always thinking that you expect them to finish the same quantity of solid food that at the same volume of breast milk. So your baby is taking maybe let's say 120 mils of breast milk or 150 mils. Then when you translate to solid food, you expect them it's going to be 120 mil of solid or 150 mils of solid. That is wrong. It's not going to be the same. So for solid, they don't need to take as much quantity to get the same amount of calories. So we need to have those understanding. So I still want to recommend first that we understand the principles behind complementary feeding. We start slowly and gradually increase. We must know how often to feed our babies. We must know what quantity to give. You must know how to present the food. So for some, maybe you try white rice alone, they don't like it, then you might want to try jollof rice. So there are many ways you can even present rice on its own. Okay, there are many ways you can make potato on its own. There are many ways you can mix them together. So you need to be patient and you need to try all this in them. Number one, we need to also, another thing we need to make sure is that we make the food presentable, colorful, palatable, warm, not cold, not leftovers. And let's not give the same thing over and over again. So some people will give pap, then children get tired of the pap itself. So pap is not complementary feeding. Okay, pap is just one of the cereal. And so it's not just only pap, like we must give pap and give it through bottle and not. Those are wrong approach towards complementary feeding. So complementary feeding is one area most parents struggle with, and I think the issue is because when we are starting, we need to understand the principles behind it. And I'm sure, Rosemary, you've listened to me several times. I'm sure you have all this information now. But you can still listen to that podcast, infant feeding the first 1,000 days, to get those principles, the FADRA principle, the frequency, the adequacy, the density, the use of food, the active feeding part. Though if your child is not eating, giving them tea is not going to make them eat, because when you give them tea, you are filling their tummy with liquid, and then the child doesn't want. Why would the child want to eat solid when their tummy is already full of water, of tea? That is a issue here. So you also want to avoid things like that. Anything that just fills once their tummy is full, then why should they want to eat again? Because there's really nothing. There's no space again anyway, and tea doesn't give them as much of the calories that we want. So you need to avoid that, and not to start children on things like that, because it's tasty, it's sweet. They will prefer that rather than the real food. So you want to take away those ones completely. if possible. If at all you want to give maybe a little, maybe with a breakfast, but not like every time tea. Then when they have tea, they're not going to have food. So those are some of the guides, principles behind complementary feeding that we want to. I think I will try and get the link to all those podcasts and put it in as I'm going on so that you guys can click on them and listen to them as well. I think that will be helpful a lot. Okay, let's move on to the next question. Okay, yeah, next question. Facebook user say my 6 weeks old baby has colic, and at some point she's breastfeeding. She feel like the pain and pull, and she does it like pull like 4 to 5 times immediately after feeding. It makes me worried. Okay, there's no reason for you to be worried. Your baby. So baby twisting and turning before they pull, is there something wrong with that? It doesn't mean they're in pain. It just means they know that something is passing through their tummy, and once they pass the gas or the pull, they are fine. It is completely okay for your baby to pass through 12 times even in a day. So 4 to 5 times is fine. There's nothing wrong with that. And babies can pass through immediately after feeding. There's completely nothing wrong with that. We call it gastrocolic reflex. So those are reflexes. So when food enters into the stomach, it kind of creates some what we call peristalsis waves. So that means that it relaxes the whole stomach, the whole intestinal length down. So what happens is that whatever is already stored. So what the stool your baby is passing is not the one your baby is just eating. It is the one your baby has already made that has been stored in the what we call the rectum. So when the baby now takes another food, because of that increased waves movements along the intestine, it relaxes that the stool that has the part of the intestine where the stools are stored, to let the stool be passed out. There's nothing wrong with that. That is absolutely normal thing. So it is your baby is not stooling out the food they are just eating, because that is a fear most mothers have. That is baby is eating, baby is stooling. That means it's the food that is coming out that is passing out. That's not true. Okay. And if you look at the stool will be normal. Okay, so there's nothing for you to worry. I know you're a first-time mom. You need to get the first-time mom companion because you've asked 4 questions in one paragraph. Okay, so we've answered the one about the colic. There's nothing to worry about. We've answered the one about the pull 4 to 5 times a day. Perfectly normal. We've answered the one about pulling immediately after breastfeeding. Perfectly normal. And then your baby's breast should never be pressed. Please tell those people doing it to stop. Okay, so it is normal for newborn babies to have their breasts enlarged, because it is the same hormones, what we call the progesterone, the same hormone that makes you breastfeed. Some of it is also passing to your baby through the placenta. So that same hormone works on your baby's breast, and that is why it is swollen. And that is why it can even bring out milk. It's just the same hormone that is doing the same thing. But because now your baby has been born, after a while, that hormone is going to clear away from your baby's blood, and the breast will go back to normal. So, but what is going to happen with you guys pressing it is that you are going to cause that breast to get infected and lead to what we call mastitis. So mastitis is infection of the breast. Sometimes it can even become with pus. And when that happens, what is going to happen is that your baby is going to need antibiotics. We may have to do surgery to bring out the pus. And all that will not have happened only if you just leave that breast alone. And all this is because some of us don't have this knowledge. And that's why I'm going to recommend that you get a first-time mom manual. I decided to write that book, or it's actually a course actually for first-time mothers, because of this kind of scenarios where we all struggles, where we just because we don't have the right understanding, then we struggle with how to support our baby. So tell the people doing those things to stop. let them stop. You can get the first time mom manual. You can join our FTM WhatsApp group. FTM WhatsApp group is available for first time moms. All these kind of 100 questions in one post, you can actually ask it on the FTM group, because we know those are the kind of questions that FTM always asks us. And there's also actually a book on all the frequently asked questions for the first time mom. So you can also get all of that as well. So those are resources for first time mom. If you need them after, you can always just send us a WhatsApp message, and we will send you out to get all these resources. So I hope that has helped the mom that is asking other question. I'm trying to see if I can share the links with you, but I'm also trying to do so many things at the same time. So apologies, but I'm sure you will see it on all our platforms and all that. So no need to worry. Okay, so most of the time for the first time, your baby actually just need you to leave them alone and not to do any of these things, because it is actually doing those things that creates more problems for the babies. Okay, the next question. Okay, thank you so much, Dr. Gbemi. I asked this question earlier on ATP. You answered me wrongly because I use medical jargons. Okay, let me ask you clearer now. Is there anything called like maternal depletion of body nutrients and vitamins after birth? Okay, so when you are asking question, I remember you now. I remember your question. When you are asking question, it's better to just go straight to what you want to ask. Because when you say, is there anything like this, it means it's either you have read about something like that, or somebody already mentioned it to you, because I'm sure you didn't just generate that thing yourself. So it is better you just come out straight and tell us what is your question, what is in your mind, because that is more helpful for the person answering your question, to know what is on your mind, rather than trying to like, is there anything like this? Those kind of question is really difficult to answer, because we don't even know what you are thinking of. So it's a little bit challenging. So that is just a general comment. So pregnancy, breastfeeding, delivery, it's something that takes a toll on a woman's body. It's like a baby is a complete parasite. If you remember your biology, a parasite is somebody that goes to another person's thing and takes everything they need. So babies are complete parasites. So when you are pregnant, the baby doesn't care whether you eat or you don't eat, or you are happy the baby just takes everything they want from you. So if you are not eating well, if you are not taking your medications and your vitamin supplement, your iron supplement, you will be losing a lot, because the baby takes everything they want from you. Especially for mothers that don't space their pregnancy well. So you have one pregnancy now, you have not fully recovered, you don't do family planning, then you go get pregnant again, then a lot of things is being taken from your body. So that is depletion, but that should not really happen. There's no reason why you should be depleted if you are aware of the requirement. So there's requirement for pregnancy, there's requirement for breastfeeding. So since what we don't, that is why we do antenatal clinic, so that when you go to antenatal clinic, we already know that your baby is going to take so much from you. So your doctors let you know that you need to eat well when you're pregnant. You need to take your iron supplement, you need to take your vitamin supplement. You need to provide those extras that the baby will need, so that you will not be depleted. But so depletion will only happen if you are pregnant and you are not giving the extras that the parasite that is in your womb is taking. So that I use the word parasite loosely. So, but that's what I mean by the fact that the baby is taking everything they want from you, so you need to be replacing it. So that is just what happens. So pregnancy itself is not supposed to deplete you. You only get depleted if you are not replacing, you are not increasing the calories you need, you are not giving the ions you need, you're not giving those. That's what people do in antenatal clinic, making sure you don't get depleted. So that is that. So if somebody has used any of those jargons around you, which is what I'm suspecting, you should ask them what they mean. You should ask them what. So it is not something any mother should be depleted. No mother should be depleted. If you were monitored in pregnancy and you were supported through pregnancy, making sure you are eating well, taking your iron supplement, you should not be depleted. So that is just what I want to say. And you should breastfeed your baby. But what we also need to do is that when you're breastfeeding your baby, you are eating well So, for example, during the breastfeeding is not the time to start thinking about weight loss. It's not the time to start thinking about all that. It's the time to think and recover from your baby. For your baby, you're losing a lot of water, you lose a lot of blood, you lose a lot of things during delivery, and now you are breastfeeding. Whether you eat or not, your babies has to take breast milk. So you need to make sure that you are replacing all that this extra person is taking from you. So that is just what I want to say. So so there's no medical diagnosis of saying a mother is depleted syndrome or whatever. There's nothing like that. It is just a description word that a doctor may use because they feel that this mother has lost so much through this pregnancy because that mother has not been getting all that the mother need, during that pregnancy. So this is why antenatal care is important. This is why family planning is important. I see a lot of mothers, oh, I'm just 6 weeks pregnant. I'm 6 weeks after delivery. I'm already pregnant again. And sometimes I just smile because most mothers don't know the importance of how serious it is. They are more worried, oh, is it going to affect my baby? Is anything going to happen? It's not, nothing may happen to the baby, but you are the one that is depleting yourself. You are not recovering. You are not recovering from that one confinement. You are going to another. Then you are going to age quickly. You are the one losing all. So it is not just about I've had my baby so quickly. It's about how well are you. And so those kind of things, pregnancy, delivery is a lot of work on the woman, and we want you to recover first before you go for another one. You should take at least 2 years, recover, be strong, let the other baby even be okay before you now start thinking, hey. So that's why you should do family planning. People always say it as if it's something, oh, as if it's something surprising. There's no surprise there. If you have had a baby, if you don't do family planning, you can get pregnant anytime. So there's no surprise because people always ask me that question like, as if it's, I find that I'm pregnant. I'm like, you are having sex, unprotected sex, you didn't do family planning. What were you expecting? You will get pregnant. And breastfeeding does not protect you 100% from getting pregnant. So if you don't want to get pregnant, when you go for your 6 weeks postpartum check, please do family planning or let your husband use condom. Or there are many family planning options. There's tablet, there's implants, there's IUCD. Do one. Don't just leave it to chance. If you leave it to chance, you will get pregnant, and you are the one that is going to be the one losing your body, and it's not the best. Honestly, it's not. So please, I guess that is what this person is trying to ask. I hope that is helpful in terms of, I hope I've answered your question. Let me put it that way. All right, so let's continue with the next question. I'll come back to Instagram. Time is running. Good evening, Abigail. My baby, after crying, my baby of 2 months sneezed for a long time. Okay, what do you mean sneeze? You mean baby? Is that what it means? Okay, if that is the case, there's nothing wrong with that. It's okay. And when you say long time, I always want people to tell me what you mean by long time. Long time, like 1 day, 1 year. I mean, no, maybe it's 2 months old. Okay, 1 hour, 2 hours, 3 hours, 4 hours, 24 hours. You need to put specificity to everything you asked so that we know, because I don't know what long time means to you. In a 2 months old baby, I don't know what long time means. So you really need to let me know. But if it's just that sound that babies make, there's nothing wrong with that. But the question is, why did baby have to cry so long? Because baby do that because they make all those sound when they have cried and cried and cried. You shouldn't allow that to happen. So we should be sensitive to the baby when they are giving us signs that they want to eat or they need their nappies to be changed. All those things, we should be sensitive to them and we should address their needs. We don't want baby crying for too long before we address them. So I'm not worried about the sniffing, and you should not really make baby cough. I'm not really sure what you mean by coughing and sniffing. This kind of question is better you do a video and show us what you really meant, so that because sometimes mothers are using words to describe things, but maybe those are not the words we will exactly use to describe them. So, but my own solution is just don't make this baby cry too long. So whatever the baby needs, please give it to them. I hope that's helpful. All right. Somebody say my baby is 13 months old. Gina is not yet walking. Okay, this is the same 13-month-old that is not eating. Okay. This baby, I now know why I'm worried about your baby. Okay, so a 13-month-old should be weighing at least 10 kilos. So your baby is weighing 7.6. This baby is underweight, and the baby is underweight because your baby is only on breast milk at 13-month-old, and that is why. So in terms of walking, I guess you mean walking like WALK. There's no reason to worry. Usually we want baby walking by 1 year, but some of them may not walk until 18 months. I will start worrying about the baby at 18 months. But what I'm worried about your baby now is the weight. That weight is small. And I know why, because of the feeding. So we need to work on that. So Gina, you need to see a pediatrician or a dietitian. They need to really help your baby quickly, because your baby is already on the weight and we don't want it to go below that anymore, because the lower it goes, there are lots of issues attached to a baby who is on the waist, who is malnourished. It becomes, we don't want that. Let's just put it that way. We don't want that. So you need to see one of us, either a dietitian or a pediatrician, because if a baby is not eating and we're still trying to help you, that's one thing. When a baby starts to lose weight, that is another level. That is now a level that a pediatrician needs to get involved, because this baby is now having a medical diagnosis, which is underweight, malnutrition. And when a baby is underweight, they carry all those kind of baby will have different problems with their development. They will have infections. They will have so many things. So we don't want that to happen. So you really need to see a pediatrician quickly so that they can take it up from there. Okay, so your 18 months old, Rosemary, your babies, I think they were they preterm? So if they were preterm, we need to calculate their corrected age. And so that will help us to know when they should start talking. So because we will correct their age until they are 2 years old. But I'm not really worried at 18 months if they are not yet. When you say talking, like speaking sentences, do they have at least one single word? Yes or no? I think I want to know that. If at least they have one single word, we can take it up from there. Okay, I'll take one more question from Facebook, then I'll go to Instagram. Good evening. My 7-year-old has a black stripe on the finger. We started 4 years ago without him eating finger. He's whining. Okay. He's worried about having a black stripe on his finger. Keep asking me why the ban. Okay, it would be nice to see this thing on the finger. And I think if something has been going on for 4 years, I think, can you just let a doctor have a look at it? We need to know, number one, what is a black stripe? Then we can answer whether it's just a mark, but obviously the baby was not born with it, so it's not a birth mark. But then we need to know what happened, and then we can now address the baby's question. All right, I hope that's helpful. Okay, now let me go back to Instagram. Instagram people, let me come back. Sorry, there's so many Instagram questions that's come. Okay, I'm trying to find where I stopped. So many people have answered. Okay, I think I know where I stopped now. Okay. Okay, the next question on Instagram. Can I hack soya bean powder? I guess powder to the pap of a 9-month-old baby. Yes, you can. That is perfectly fine to do. Next question, Shifel Girl, say good evening, dog. I just put to bed. Congratulations. Through cesarean, and I've been coughing. Why? Which is very excruciating. Can I take ginger? No, if you are coughing after CS, you need to see your surgeon, no, not to be taking ginger. You need to know why you are coughing. It's serious. You need to see the surgeon. When you say you just gave birth to, okay, on Friday, today is Monday, 4 days, please let them call your surgeon. They need to know why you are coughing. You just had an operation. You just had a major surgery and you are coughing. Your surgeon must be called. Your anesthesia. You didn't tell me, did you sleep during your anesthesia or were you awake? It's very important. So when you are coughing, I'm sure you are still in the hospital. 4 days after CS, you should still be in the hospital. But if you have gone home, you really need to go back and see your surgeon. It's very important. Very, very urgent. That's an emergency. Seriously, don't go and be taking garlic, or we need to know why you are coughing. Is there water gathering in your chest? Is there anything going to your chest? They need to know that. They need to solve that. Anybody who had that operation must be followed up. And if there's any symptom like that, the right people need to do it. Don't just assume it's just cough. There's no reason why you should be coughing. So please do that quickly. Shifega say, can I take breastfeeding cookies and tea? Okay, some people say it works. If it works for you, fine, take it. I don't really think it does anything. But the most important thing for breastfeeding for Chifega is put your baby to the breast. Okay, breastfeeding is demand and supply. The more your baby suck, the more the milk will flow. So no matter the cookies, no matter the tea you drink, if your baby is not sucking on that breast, the milk is not going to flow because the body only produces what will be needed. So if there's no demand on the breast for milk, there will be no production. So that is important to do. Of course, you should drink a lot of water and all that. So yeah, all those things you've said, people say it works. I don't have any problem with it. Please use it. Just make sure the baby is also sucking on the breast. That is our own part of it. Okay. Ladiolu say, good evening, ma. My 19-month-old has only 8 teeth. Is it normal? That is perfectly normal. My last podcast was on teething. So you can just look for Dr. Gbemi ATP, ask Dr. Gbemi ATP. So I answered this question. Teething. It's we want your baby to have 20 teeth by the end of 3 years. So maybe it will bring out everything at once, or maybe we'll take their time, but most important is that they are teeth, so don't worry about it. The next person, Chifega. Okay, Chifega, you must be a first time mom. So when people ask 5, 6 questions at once, they are first time mom. You can join our first time mom class. You can also buy the first time mom companion. I'm sure it will be helpful for you. And you can get the 500 questions for first time moms. All these your questions, I know that we've answered them in that book. Can I bath my newborn baby once a day? Yes. I don't have a help. You don't need a help. That's why you need the first time mom companion. You can bath your baby by yourself and you can do it from day one, and once a day is fine. Okay, I can't write a comment now. Maybe later I'll drop a link there when I can. Next person, or you can just send it on a DM. Somebody will send you the link. Ire, she can say, my 3-year-old is having recurrent cancer. What should I do? So when you say recurrent, like how many days, how many months? Because if it's something that's been going on for months, then we are thinking of something maybe allergic rhinitis and all that. Then you need to see the ENT doctors. If it's just something that just happened recently, it may just be the weather and all that. Just most important thing is to keep them away from those who have the cancer, hand washing, lot of fluids. It will go. Most of them are viral infections. They will resolve by themselves. But if it's happening over and over again, then the ENT doctors want to see you to be sure whether it's allergic rhinitis, and that may require other form of treatment beyond just what we normally do for viral one. Okay, Kemi Simon. My daughter is 3 months old, but still shows signs of colic, their movements and so on. Okay, colic is not movements. Okay, anyway, but there's nothing wrong with a 3 months old having colic. Colic can happen to up to 4 months old, so there's no. But that movement is not colic. Okay, the definition of colic is a baby who is crying continuously for what look like no reason. You've done everything, baby just cry. They just cry for hours, and then they will stop. So you just, what you need to do, try and comfort them, find a way, but again, just hanging there, most of them will go away. So that movement that babies make when they are about to pass stool and when they're about to pass gas and all that, it's perfectly fine. This is just babies being sensitive to all the gas, everything moving through their body. They are just very sensitive. So they kind of twist and turn the body, but once they pass the gas or the stool, they are fine. But you also make sure you don't allow them to have too much gas, because when they have a lot of gas going through, then they do it a lot more. So what we normally recommend that don't let baby suck on bottle dummies. That's where they suck in gas a lot, and don't let them cry too much before you attend to them, because that's also how they take in all those gas, and those are the things that make them. So they need to pass out all those gas, and it is the movement of those gas makes them feel uncomfortable. Really, it is not really pain like mothers always think. It's just that they are not comfortable, or they are very aware, let me put it that way, of that movement. But you see that once they pass the gas, they are fine. And some of the medication that we give, like Infacol, is what it does is to make it easier for that gas to be passed, and that's it. But most colic will go away by the age of 4 years. Okay, I think I have one question in the question. Okay, Rene. Okay, it's same question I've answered. Rene Chika is about 3 years with recurrent catarrh. So, you can see the ENT doctor. It may be allergic rhinitis. Though you didn't give us a lot more information, which could have helped us to tease it out. The next question by Kemi: what can make a woman to always have children with challenge? This is a very big question. Oh. For example, the first came with Pierre Robin syndrome, but died at 9 months. The second is okay. The third has birthing problem, has breathing problem, and can talk. Okay, so it's only one person that has a problem here now, the Pierre Robin syndrome. I'm not sure I get the third one. The third one, breathing. What is the cause of the breathing problem? I'm not sure I get that part. But most babies can have any breathing issues. Okay, so some number one, it depends on what condition those babies have. So if, like for example, the baby that has Pierre Robin, is some things just happen random chance they happen. We can't explain why they happen, but there are some conditions that are genetic that can happen again in same family. They run in some family. So also even the kind of care the mother gets, what kind of care does she get during pregnancy, during antenatal care, during delivery, could those be impacting on a baby? So it depends on the individual scenario. So this, for example, this scenario now, I'm still wondering what is recurrent about this one. She just had one baby what looked like a syndrome, but the third baby, I'm not sure what you meant about that baby. You said baby has breathing problem. Is the baby still having breathing problem now? What is, maybe you may need to give me more clarity, because otherwise I'll just say it's only one child that I think has any genetic issue, which we can't say why it happens. Some of them just happen randomly. All right, then Timmy T. My 20-month-old isn't talking and it's not saying any word. You need to see a speech therapist. Yeah, if a 20-month-old does not have any single word, you should see a speech therapist. All right. Demi is 8.67 weight. Okay, for a 9-month-old. It's not so bad. A 9-month-old averagely weighs 9 kilos, but 8.6 is still okay. So we have a range. We have between 80 to 120% of the average. So if your 9-month-old is weighing 9 kilos, it's fine. But if you weigh a little bit less than 9 kilos, it's fine. A little bit above 9 kilos is fine. We have on our website, you can also go to our website. I have a article on Is My Baby's Weight, what is my ideal baby weight? So we teach you how to calculate baby's weight, how to check it. You can also plot it on the graph in your immunization book and look at it. So, but it's fine. Don't need to worry. And there are lots of apps. There are lots of calculators online. Just put the weight in. They will tell you whether the weight is within normal range or not. And then the next question, Beauty, what can I use for a 4-month-old with cough and catarrh? 4-month-old with cough and catarrh, nothing. Just breastfeed, keep the baby warm and breastfeed, and keep them away from people that have cough and catarrh, because they are the one that gave the baby the cough and catarrh. Most of the cough and catarrh is just what do you call it now? It's just viral infections, and they will run their course and then they will stop. So there's nothing for you to do. The third child is having breathing problem. She make wheezing. So what is the diagnosis? Is it asthmatic? How old is this third child? Miss Simon, I think your question is something beyond the scope of this beyond the scope of this platform, because I need to ask you so many questions. But I think that mom should see a pediatrician. We can have a conversation. We can talk about whether it's something that can happen again, or whether it's something that we can prevent from happening again. So I'll recommend that. Okay, I think I've answered all Instagram people's questions. Let's go on back to Facebook, and I don't think I have any question on live audio yet. Okay, yes, where's comments? Where did I stop? Okay, I've seen where I stop. Okay, the next question is, good evening, my son of 6-year-old grinds his teeth at night when he sleeps. Is there any solution to this? Yes, there is. We call it bruxism, and for the dentist, it may just be an habit, but for the neurologist, it may be a form of convulsion, a seizure. So I'll really say, see the dentist first. Let them decide whether it's an habit. Sometimes they have something they can make the baby to wear and all those things they do to kind of reduce it. But if there are other issues, medical issues, then you may need to see the pediatric neurologist or the pediatrician first as well, so that we know which one it is that your baby is having. It may just be an habit, but it may be more than an habit. Okay, Blessing saying, good evening, doc. My 2-year, 4 months has rashes. Should I use dusting powder? No. We need to know what the rash is first, okay? There's no, I know mothers like to, some people say, I have rash, then you just recommend, bam, go and use this, go and use that. It's the most dangerous approach to anything when it comes to rashes, because you can actually convert something that is even a simple one, maybe that will even disappear on its own if you don't do anything, to something that will be worse. So when there's a rash, we need to know why the child has a rash. We need to know what kind of rash, what is the cause of a rash. For example, dusting powder is for itch rashes only. So if your baby does not have itch rashes, if your baby has a fungal infection or a bacterial infection and you're going to put dusting powder, it's not going to go. It's going to make it worse. Okay, so we need to know what the rash is before we know how to treat the rash. So I'm happy you have not used any powder. So what you need to do is to send us a picture on our Facebook groups. Then I will tell you, okay, this is a fungal infection. You need to see a doctor to prescribe antifungal. Or this is a itch rash. Okay, yes. Or, we need to know the rash. So before we recommend, that's how doctors work. We don't work like mothers. We just, once you tell them cough, they'll just recommend this for you. No, for doctors, we need to know why, because there are like 1,001 things that can cause rashes. So we need to know which of them the baby is dealing with, and then that will tell us the right approach. So you can just post a picture since you're a member of our Facebook group. All right, I hope I've answered that. Oh, where am I? I've lost where I was. Okay. Okay, I've seen. Okay, so Rosemary is back. Your baby love banana. There's nothing wrong with loving banana. They should eat banana. But they should not eat only banana now. They can eat one. So for your babies at that age, you want them to have 2 snacks a day. 2 snacks a day is fine. So 1 banana at 1 snack time is good. Okay. So they can't just keep eating banana. They will have no time to eat other food. See, that's the point. You need to also understand how to balance all these things, because if you eat too much banana, there will be no time to eat rice or other food that you want them to eat. But I'm happy they love banana. Is good fruits. So let them eat that one, but not eat more than 1 or 2 in a day. Facebook is my son, 4 months old, has itchy scalp. Help. Okay, itchy scalp. What is itch? What is on the scalp? Are there like dandruff stuff coming off the scalp? Is there like a wound on the scalp? Is there like something like water with pus on the scalp? I need to see that scalp. I need to know what is going on in that scalp before we can recommend anything. So this kind of question, you need to put a picture of the scalp, or you need to provide more information about the scalp, and then we can take it up from there. Then birth weight is 2.8, weight is 6 kilos, the weight is fine, exclusive breastfeeding. He also has irritation on his bum. So okay, we are coming closer now. So if the baby has irritation on his bum, is it nappy rashes, or is it the same kind of infection that is on the scalp that is also on the bum, which most likely sometimes could be fungal infection? So we need, unfortunately, you can't put a picture of the bum on our Facebook group. Unfortunately, we can't, because it's against our Facebook community standard to show private parts pictures. So you have to see a doctor for that. But for the scalp, you can post that picture, and or you can tell us more information. For example, what I'm thinking of in this age group could be maybe cradle cap or something like that. So and that one we can easily tell you what to do. But that would be like there's some fungal like flakes, coming off the hair and all that. So we need to know that. Or is it that you are putting some oil that you've added so many things to, and that is irritating the baby's scalp, and that's going to make maybe to itch? So we need to have all the background information before we can give additional. Okay, I don't know who is this in addition. My symptoms. I don't know who is this. Who is this person? I can't see your face. Is it the same Facebook user that I just finished answering that is saying this? Because the person said that in addition, and I wonder what is at the addition. So
My symptoms are extreme tiredness, breathlessness, blah blah blah. Okay, because you're a Facebook user, okay, I think it's the person that is asking me about depletion and all that. This question is not a Facebook thing. So you are breathless, you are tired, after 4 months of giving birth. I really think you should see your own doctor, and I'm not really sure. I personally think maybe you have postpartum depression. It can also show as signs of physical symptoms. And because your doctors have done all the echo, they've done ECG, they've done thyroid, they've done everything, and everything is fine. So if everything is fine, and what is coming to my mind is what I initially told you when you posed your first question, it's most likely it's postpartum depression. Yes, all this extreme tiredness, feeling dizzy, you just need some rest, and maybe you also need to see one of our mental health providers, psychiatrists. Yes. It doesn't, I'm not really sure it has to do with your breastfeeding. You can breastfeed as long as you're breastfeeding and your breast milk is flowing and all that, that's fine. But if your doctors have ruled out physical issues and you are still having all these symptoms, we need to rule out postpartum depression. And it can happen. It can happen. But don't worry, there's help as well. Maybe you should just send us a message. I can link you up with those people that can support you with that. Okay, Udrak say my toddler of 1 year, 10 months old like biscuits mixed with milk. Who introduced this 1 year to biscuits is the mommy. So please, there's nothing wrong with taking biscuit, taking milk and all that, but we don't want babies to be taking out of junks. So we don't want them taking biscuits, all the, those are not healthy snacks. We want you to give them healthy snacks. I'd rather the baby take a fruit mixed with milk, like a smoothie. Is better. You mix your banana with milk and make a smoothie. That is healthier than biscuits. So those kind of biscuits and stuff, we call them sweets. So those kind of things, you want to use them as treats. Things that baby take maybe once in a while, maybe when they go for all those their birthday parties, maybe once in a week. It's not something they should be taking every day. So they are junk food. We don't want your children on junk. We want them to take healthy snacks. So let's replace the biscuit with something else. Maybe banana, maybe watermelon, maybe something else. But let's try and reduce the junk. Okay. All right. The next question. Um. Let me go. Melvin says, it's okay for 5 months old to sleep through the night up to 8 hours without sucking. As I feel I should not disturb her sleep. Even when I do, she doesn't really suck. She just wants to be allowed to enjoy her sleep. So some babies are like that, but really we prefer your babies to suck. Especially if your baby is on exclusive breastfeeding. You didn't tell us whether baby is on exclusive breastfeeding now. Is your baby on exclusive breastfeeding or you are giving other food? Because if you are giving other food, sometimes some babies will not need to take as much, as much, and they can sleep through the night. But if you are breastfeeding only, I think 8 hours is too long for the baby not to suck at all. And like you said, you can actually take the baby even when they're sleeping, you can breastfeed them. And mothers ask me this question all the time. And I always tell them babies can suck even when they're sleeping. They don't need to wake to suck. Just put them to the breast and they will suck and keep on sleeping. And when they're done, you take them back. So, but 8 hours, no food at all for a baby on exclusive breastfeeding is a lot. Is a lot. Okay, Samuel Chidera say my 13 months old loves banana a lot. Okay, everybody loves banana today. That's good. I like banana too. She has two teeth in the lower jaw. Should I be worried? Which one are you worried about? Is it the teeth or the banana? Because it's not clear to us. It's okay for the baby to take banana. It's okay for the baby to have two teeth. There's no reason to worry whatsoever. Okay, I was just showing this one so those who want to join our FTM classes, you can join us. And for those who want to get the 80, for those who want to get the FTM manual, you can also get that. I'll try and see if I can post the link. Okay, Osioma Onwudiwe, 11 days old baby sleeps almost throughout the day. Yes, they sleep a lot at that age. There's nothing wrong with that. They all sleep a lot. A newborn baby can sleep up to 16 to 20 hours in a day. 16 to 20 hours. So that is perfectly fine. There's nothing wrong with that. Yeah, there's nothing wrong with baby straining to pull or straining to pass tools as well. That's all normal for newborns. And how can I help him? There's nothing to help. The baby is fine. There's nothing to help. But your baby needs to breastfeed. So they sleep a lot, but that 4 hours of the day that they are awake, they should suck. So usually they will suck, and then they will sleep for 3-4 hours, then they wake and they will suck, then they will sleep for another 3-4 hours. So that's fine. So at least they still have like 4-hour windows of the day to suck. So there's nothing wrong with that, and there's absolutely nothing wrong with your baby. So just keep breastfeeding and relax, and you can get our first FTM manual for those to help you with that. Okay, where did I stop? Okay, I've seen where I stopped. Yeah, 5 hours and more. Abigail, I'm trying to remember what Abigail's question was. Okay, Abigail was the one that asked, your baby cry, okay, for 5 hours. That's a long time, 5 hours is a long time, but please don't let the baby be crying too much. And is it something that happens again, like every day, or is it something that just happens once off and that's it? So there's no reason to worry. But if it's happening every day, I want you to see a pediatrician, because you say baby is coughing, is sniffing, and if it's happening frequently, like it's not just like one day event, it happens again every day, I really want to be sure there's nothing else going on there, and I really want you to see one of my colleagues. Okay, doctor, can I combine malaria syrup and cefuroxime at the same time for a baby of 13-month-old? Okay, number one, I'm not a fan of people that treat malaria and infection at the same time. It's very unusual. It's a very unlucky baby that will have both malaria and infection at the same time. Very, very unusual. But I noticed that is a standard practice in most of our hospitals, especially in Lagos, Nigeria, which is wrong. We should make up our mind whether your baby has malaria or whether your baby has infection. It's very unlikely for the baby to have the two. So I usually don't like this double barrel kind of treatment. To me, it's a treatment by people who are just don't made up their mind. So they're like, okay, let me just treat everything, whether it's malaria, infection, let's just give everything. So, but it's actually not good. Some of them is just unnecessary use of medication. But then I'm not going to question your doctor. If your doctor has recommended it for you, you should go ahead and do it. But I prefer they make up their mind to see which exactly is the cause of your baby's fever. Okay, Deborah is saying, how often should I give my baby of 3 months water? She's on formula and breast milk. Okay, Deborah, why is your baby not on exclusive breastfeeding? We want your baby to be on exclusive breastfeeding. That is the best for your baby. So if your baby is on exclusive breastfeeding, your baby will not need water. But if your baby is on formula, your baby, each time you give formula, you have to give plain water. So it is with the formula. So the formula will determine how often you give plain water. So if you give formula once a day, then water will be once a day. If you give it twice a day, but I would recommend that you just put your baby on exclusive breastfeeding, because there are some protection your baby gets from exclusive breastfeeding. It's not going to get it from the formula, but it's your choice anyway. I'm just recommending what is best, but you still have to take your decision. No pressure on you. Another person say, my 9-month-old have cut off for 2 weeks, running nose, it's not breastfeeding again. Why? Next doctor appointment is next week. What can I do? You should see your doctors, but I'm worried. Why is your 9-month-old not breastfeeding? And the kata is really going on for 2 weeks. It's too long, so you should really see your doctor. If your doctor's appointment is next week, you can always bring it forward. If you have something important to tell your doctor, you don't have to always wait until the day of your appointment. You can always go and see your doctors before your appointment. You can tell them I have some concerns, and trust me, they will see you. Okay, the next question. My baby pools after breastfeeding almost immediately. That is normal. I think I've answered that already. That is perfectly normal. There's nothing to worry about. And then the next question, hiccups is fine. Hiccup is also normal. It's nothing to worry about. Okay, so this Facebook user, you can, okay, no, it's not Nkechi. Nkechi is a different person. I want to say whether it's the same person, then that means you must be a first-time mom. So hiccups is normal in babies. It will go by itself. Some mothers say, okay, let me breastfeed. It's whether you breastfeed or whether but don't give water, I'll just breastfeed, it will go. Some people put white clothes on the hair. Okay, this week, is it which day of the week am I talking about? Meats. So you can join us on our Facebook group for that discussion on meats. So it's one of those meats that doesn't really do anything anyway, but it doesn't do anything. So it's okay. There's no need for any treatment. It will go by itself. Anonga is saying, what age should I be worried about the development of a girl child? You have to be very specific with which development you are worried about. Then we will now tell you which age you should be worried about it. So when you say development of a, that's a very broad thing to talk about. Development. Are you worried about the speech? Are you worried about the gross motor? Are you worried about puberty? What are you worried about? You have to narrow it down. Then we can give you the right answer. Roslyn says, sorry, I have a question. Ask your question. You don't need to ask for permission. My baby was 3.3, have 6 weeks, 5.6, and then she wasn't gaining weight. She cried, put back at the side of my breast, this thing for a week. At 10 weeks, she dropped, surprisingly. Why would that surprise you? Baby was not sucking, so there's nothing surprised there. Then I had to visit eye hospital back to lay my complaints. The hospital. Then I was told to run malaria test. She was positive. Okay, so Roslyn, your question has cut off because you are giving too much information. I can't see the rest of your question. Why not just go straight and ask the question that you want to ask? Just go straight to the question, and then we can answer it. So, Roslyn, I'm really interested in your question, but your explanation has cut off the rest of the question. So, can you just ask the question alone? Don't bother with all the background story. The next question says, I was told that of immunization vaccine, that one out of immunization vaccine prevent bronchitis. Why is it that my children was diagnosed with bronchitis? I don't know who gave you that information. That information is wrong. Number one, we don't even diagnose bronchitis in children. Number one, let's start with that. Who made diagnosis of bronchitis? It's not a common diagnosis we make in children. So you need to let them know what is the diagnosis of your children. Maybe it's either it's bronchiolitis or bronchopneumonia. We don't tend to diagnose bronchitis in children. That's number one. Number two, when we say vaccine protects against something, we are very specific. There's no vaccine that protects against for example, let me give you an example. We say vaccine protects against pneumonia. We are being very specific. It protects against pneumonia caused by measles, pneumonia caused by pneumococcal, pneumonia caused by H influenza, and those are the pneumonias that vaccine will protect. But there are other bacteria, there are other viruses that will cause pneumonia that we don't have vaccine for. So let's get that correct. So we don't have vaccines for every single disease under heaven. So you need to know that. Even when we say pneumonia is protected by vaccine, it is some specific pneumonia caused by certain bacteria or viruses that we have vaccines for. There are still other germs that can cause pneumonia that we don't have vaccines for. So, for example, if your baby take pneumococcal vaccine, your baby will be protected against pneumonia caused by pneumococcal vaccine. Even for that pneumococcal vaccine, if I want to shock you more, we don't have the vaccine for every single strain. I think we have for about, maybe there's PCV13, there's PP10. So we have some that covers 10 of those strains. We have one that covers 13. So that means that if your baby has pneumonia from another strain that is not covered by the vaccine, your baby will still have pneumonia. So when I teach on immunization and I have a podcast on child immunization, I explain this thoroughly because parents need to understand that. So the fact that you took vaccine does not mean you should now throw precaution to the wind. Does not mean you should not take precaution of hygiene or making sure your baby is not exposed to those who have cough and catarrh and all that. You still have to take precautions because vaccines do not cover every single disease. So you need to know that. So it's very, very important. I hope that is helpful. But more importantly, I think you should go and see a pediatrician because we don't diagnose bronchitis in children. I really want to know what condition. And then you say all your children have it. That again is also another red flag. Why is all your children having the same condition? Is it bronchial asthma that your children have? Because that's about one condition I think can recur in family if it's because it has some genetic predisposition. So your children have all the same condition and all that. I'm worried about that. So I think you should have that conversation with a pediatrician or whichever doctor gave you that diagnosis so that you really understand. Because sometimes it also maybe what they told you is not what you are telling me, which sometimes happen. Maybe that's what you thought you had them say, and they actually said something different. So sometimes that happens a lot. I think I've answered this question about malaria And this Dr. Gbemi, your smiles are charming. Oh, thank you so much. May God continue to bless you. Amen. Thank you. All right. Oh, breast development. Okay, thank you, Alonga. So for breast development, usually most we call it telaki. So most children, usually from anything from age of 8 years, they can start having it. Usually by the age of 16, if there's none, that is when we will be worried, because like everything in development, everything is a range. Some people early, some people late. But if by 16 years your child does not have any form of breast development, does not have any form of like menstrual period or any form of puberty, we want you to see us. We want you to see us at that time. But before that time, may just be some people are late, what we call late bloomers. Some people are just late. Some people are very early, 8 years old, everything is there. So but most people is around the age of between 12, 13. All those things will start happening. So, but there's no reason to worry. But by 16 and there's none, yes, you should see a pediatrician. Your baby suck one breast. That is not right. Your baby should suck both breasts. There's a reason why God gave us two. So your baby should suck both breasts. You should start on the first breast that your baby doesn't tend to suck, and then you switch. And you must alternate your breasts. You must attach your baby well to the breast. You may need to go through our breastfeeding guide. You may need to go through the FTM companion on breastfeeding. You really need to understand breastfeeding. Baby sucking on one breast, most time is the mother's. It is not the baby. You need to make sure you're giving the baby two breasts, and make sure you are putting the breast properly in their mouth. You need to, and alternating the breast. It's so important to get it right, because one breast is not enough for your baby. You need the two. That is why you have two of them. Okay. Well done, doctor. Where can I get 9 years, 3 months old access as regards development? Okay, we do on ATP clinics, we offer video consultation, and we do video developmental assessment as well. If you want that, you can come to ATP clinic. Just send us a WhatsApp message. If you don't want that, in Ogun State, I don't know whether you can try your teaching hospital, or you can come to Lagos. Ogun State is really not that far from Lagos, really. So you can come to Lagos and they can do it for you. But you can try your old suits, your teaching hospital, or I'm not so sure developmental pediatric services in Ogun State, to be honest. Yeah. Okay. Oh, okay, Roslyn, thank you. So your 2 months old weigh 5.6 at 6 kg, dropped to 5 kg at 10 weeks. Due to lack of feeding caused by malaria. Will she gain back weight when she's sucking? Well, yes. Okay, so that's all you want to ask me. Yes. So now that you are back, your baby is fine. Or is it you that has malaria or the baby that has malaria? I'm not sure which of you has malaria. Anyway, but everybody is fine now. Please let the baby suck on demand. And I actually think your baby jumped from what was the birth weight you told me earlier? Let me go back. So your baby birth weight was 3.3. I actually think that 3.3 to 5.6 at 6 weeks was actually maybe a measurement error. It is very unusual for your baby to have gained, is it 2.3 kilos in 6 weeks? That is actually like too much. So the 5 kilos, yeah, maybe. So, but it's possible. I'm not saying it's impossible, but sometimes there's measurement error as well. So that 5.6 may be a measurement error, but I'm not really worried about your baby right now. I just want you to breastfeed the baby. Your baby is 10 weeks. Let's breastfeed, and let's check the weight again at 14 weeks when you go for your immunization, and let's see whether it has gone up. And that's what we want. All right, time is up. We need to round up now. I'm just going to quickly answer all the questions that have come in now, and then we'll stop. Good afternoon. Baby developed fever today. Took her to lab. No, so when your baby has fever, don't take them to the lab. I don't like reading that. When children are sick, please don't take them to the lab. Take them to the hospital. Let the doctor see them first. Let the doctor decide what is wrong with your child, and let the doctor treat your child. I know you guys do it for yourself. I'm not going to talk to the adults. Whatever you want to do with your own body, you are a competent adults. So you do whatever you like. You have autonomy. But please, for our children, don't take them to the lab when they are sick. Take them to the hospital. Let the doctor be the one to tell you what test to do. A child has fever. There are hundreds of things that can cause fever. It's not only malaria. So you've gone to the hospital now. You've only done malaria. We don't check for infection. We didn't check for other things. So how do we know it's malaria? And all these labs, they want to make money. Everybody will always have malaria. They always have 1+ malaria in Lagos. They will always have it. So, okay, so the pharmacist told you that malaria is not a concern. Okay, thank God. And she hardly eats. How old is this baby? You didn't tell us. Baby is 3 months old. Okay. Oh, 7 months old. Okay. She's except breast milk. She's so weak. She's cranky. Panda paracetamol. 0.3 means for a 7 month old is not paracetamol. That's not the dose at this age. Okay. Okay, so let just, your question is too long, it has gotten cut off. Okay, for this mom, if your baby has fever, give paracetamol. Your baby is 7 months old. The weight is 6.4 as I said, 6 months old. So that's 15 milligram per kilos. That's about 90. Okay, so that is at least 3.5 meals of paracetamol, and your baby is 7 months old now. So I would just say give 4 meals of paracetamol syrup, not the panda one, no, not those 0.3 one. No. Go and buy normal paracetamol syrup. It has 120 milligram of paracetamol in 5 meals. Give your baby 4 meals, and then you can give it every 6 hours. Okay. Then, if your baby keeps on having fever by tomorrow, take your baby to see a doctor because your baby is having fever, your baby is cranky. Did you check the temperature? Okay, it's 38. So take the baby to the hospital and let them examine the baby. Let us know why the baby is having fever. It may still be malaria, it may be something else, but let's do a proper evaluation. All the people that have seen your babies are not trained to examine babies. They are not trained to make diagnosis. Neither the lab scientists, neither the pharmacists are trained to make diagnosis of what is causing fever in a child. The pharmacist's job is to give you a medication, to dispense it, to tell you how to use it. The lab scientist's job is to do a lab test. It is the doctor's job to ask you questions, examine your child, and know what is wrong with your child. Everybody has their job role clearly defined. So there's no reason why everybody should take over another person's job. It is not the best. It is not in the best interest of your own child. I'm not saying this about professional anything. It's about your own child getting the right thing. So give paracetamol 4 meals every 6 hours. By tomorrow, check the temperature again. If it is still high, then please see a doctor for proper evaluation, because I'm worried about a child who is cranky and all that. I really want to know what is wrong with this child. Okay. Yes. When a child is having temperature, you tell us to either undress them, wear a single clothes. Situation where the child is running temperature and shivering, what should be done? Okay, if your child is running temperature and shivering, maybe it's having what we call rigor. So in that case, what you need to do, give them paracetamol. You can cover them up. You can cover them. I know it's a little bit tricky, but you can cover them up and then give them paracetamol. Most of the time when they sweat, that tends to happen a lot in people that have malaria. Malaria is one of the common reasons why you get that kind of scenario. Give them paracetamol, cover them. When they sweat out, the rigor stops and all that. Okay, I think I've answered this question. Okay, the final question. Thank you so much, Facebook user, for the compliment. Thank you. Where can I see ATP WhatsApp number? Okay, let me show you the WhatsApp number. Where did I keep it now? That's the WhatsApp number. Okay, that's ATP WhatsApp number. It's everywhere, you can't miss it. Final question. My baby's eyes bring out yellowish mucus and it's difficult to open his eyes. Okay, that sounds like an eye discharge, and because it's yellowish, what I normally recommend, just clean it with water and cloth. If when during the day your baby still bring out eye discharge again, then you need to see a pediatrician so that they can treat it. Not a pediatrician, any doctor can treat an eye discharge anyway. So that is the last question on Facebook. And like I said, for the first time moms, you can join our first time mom group. You can buy the first time mom course. And then you can learn a lot more. You can buy the frequently asked questions for first time moms as well. You can always get all those materials. It will help you. Trust me, it will. Okay. Final questions from Instagram, then we'll close. Okay, I think I've answered that one. Can my baby have a flu shot with vitamin A at 6 months immunization? Okay, vitamin A, yes. Flu shots, I'm not very comfortable with flu shots. We don't really have flu in Nigeria, really. So even in countries where they have flu, even in countries where they have flu like UK and red, they don't give the 6 month old flu vaccine. So I wonder why people are trying to sell it to you guys in Nigeria. It's really not necessary. People are just have to make money. Flu is not an issue in Nigeria. And even countries where they have flu, they don't give it to the 6 month old. So please stick to the Nigerian program on immunization. Stick to that. The only vaccines that you can take that is outside Nigerian program on immunization, you can take your chickenpox vaccine, you can take your human papilloma virus vaccine, HPV, chickenpox vaccine, mumps or MMR. If you want to take those ones, are okay. You can take those ones. Those ones are not part of Nigerian program on immunization, but the rest of them just stick to the Nigerian program on immunization. All these private hospitals trying to sell flu vaccine, I see no justification for it. And I'm looking at the vaccine schedule of other countries like UK and US, where the children actually are prone to flu. They don't give them at 6 months. They give them when they're in school age. So that's it. That's the honest truth. Okay. Omalara say, so I have a podcast on childhood immunization. You can also listen to that. I address the issue of Nigerian program and the MPI vaccines that you can take as well. Can I use a 0.2 to 24-month toothpaste for a baby of 1 year, 1 month? Yes, you can. You can. It's still within the age range. Last question, Judy Law. My baby of 1 year, 3 months have atopic dermatitis on the skin, which comes and goes. What can I be applying on the skin? So if you know your baby has atopic dermatitis, somebody makes that diagnosis. So if somebody makes that diagnosis, that person must have told you what to do, because it's not a diagnosis mother should make. So I really want to believe that a dermatologist or a pediatrician makes a diagnosis and they will recommend treatment, because I don't want to recommend something for you that is not for the right diagnosis. So if your baby really, so I'm really being careful now. So I always don't like parents telling me diagnosis except it was given to them by a doctor. So if you think your baby has that diagnosis, I believe the doctor will give the diagnosis, will give you the treatment. But if you are assuming it was, or maybe one of us have told you it was, then we would have recommended what you should do. I'd rather you send me a picture of that rashes on our ATP Facebook group, because wrong treatment, for example, in atopic dermatitis, we sometimes use steroids and all that. It will be wrong treatment on a child who has an infection as a cause of the rash. It will worsen it. So that is why we really always need to be sure. But general precaution for atopic dermatitis: avoid chemical products, use hypoallergenic products. So use things that are that are natural, that are likely not going to irritate the child's skin. Keep the skin well moisturized. Keep the nails short so that the child doesn't scratch a lot. Sometimes your doctors may have to give you something for itching, because itching can be quite bad in atopic dermatitis. So you need to follow all those principles first. And of course, your dermatologist is going to be your friend, because just like you've rightly said, atopic dermatitis come and go for a long time. So it's something you have to keep. So what we normally do is that we treat each flare, each episode, each recurrent episode is treated. But in between those episodes, we follow all those precaution methods so that it doesn't happen. I hope that's helpful. But if you want more information on that, will you please post that on our Facebook group, because I can even give you a link to the atopic dermatitis information from our dermatologist so that you have that. But we'll be careful. We are careful when we don't see rashes to tell you what to do, that we don't give you the wrong information. Can a child that has taken immunization for measles still have measles? The honest answer is yes, it can. It's just like you take COVID vaccine, you can still have COVID. So vaccine is not like 100% miracle. But the good thing about vaccine is that if your child even have measles, despite taking measles vaccine, your child is not going to have a severe measles. It's likely going to have a mild form of measles. I can tell you one like 4 or 5 reasons why a child was supposed to have taken measles vaccine can have measles. I can tell you why. Number one to start with is that most parents diagnose measles wrongly. Most people just see rashes and they say it's measles. It is not every rash that is measles. Let's even start with that. Every day I get questions telling me my baby has measles. My baby has measles. And what they just want to say that maybe has skin rashes. Because measles will start with fever, with cough, with red eyes, with catarrh, and all that. What we call the symptoms, the prodromal symptom that will start first. Then your baby will not have the rash. And the rash start from the headline and go down. Most people just see rashes and they say my baby has measles, or somebody experienced mother told them your baby has measles. Mm-mm. Even when the baby look like the baby has measles rash, ampiclox can cause the same rash. There are so many other things that can cause that same rash that look like measles rash. So it's only a doctor that should diagnose measles. So when mothers tell me measles, I don't even believe mothers' measles diagnosis, because everybody has either measles or chicken pox or eat rashes. Those are the only three diagnoses of rashes that mothers will make. And that is not true. Okay. So I always want to see rashes. I always want to ask you, did your baby have fever? Did your baby have catarrh? Did your baby have red eyes? Did your baby have cough? If your baby doesn't have the 3 C's of measles, cough, catarrh, conjunctivitis, and no fever, your child does not have measles. Let's start with father. Many people saying that child has measles, child has no measles. Okay, that is number one. No, but two, even when you look like the child has measles, measles has to be confirmed. Like you have to take the virus to the lab and really be sure it's measles, because that's, like I just told you now, there are other conditions that can look like measles that are not even measles. That is number two. Number three, as at the time your child was given a measles vaccine, was the vaccine still potent? Is he a trained of it that take your vaccines in private hospitals? Most of those private hospitals with Nigeria, no lies, no this, they don't keep the vaccines well. I always tell people, even me as a pediatrician, I take my children to a center to take vaccines, because that is where you're going to get the best vaccines, because they take their vaccines straight from the lab where it is stored and bring it that day, and they give it that day, and that's the end. They don't store it. They take it fresh. But most of these private hospitals store the vaccines. Sometimes the lights goes off. Most of them obviously has generators and all that. So I'm not saying that most of them don't store it well, but some. So you just be very careful with that. So that is number one. So if the cold chain is broken, you may get a vaccine, but you are not getting a potent vaccine. That is number two. Number three, when we give your baby the vaccine, if your own antibodies against measles, they are still very potent. Like, as a mother, you are the one protecting your baby against measles for the first 9 months. I hope you know that, because you already have antibodies that you give to your baby against measles. So when we give your baby, but we expect that by 9 months, your own should have stopped working and we can now give your baby vaccine. But sometimes when we give your baby the vaccine, your own is still working. So what do they do? They destroy the vaccine that we have just given to the baby. So what that means that even though we're given the vaccine, your baby did not have immunization. Your baby was just vaccinated. And that is why we are now giving measles vaccine twice. So we give at 9 months. We also give at 15 months, because we are trying to say that if we the one we give at 9 months, peradventure for some mothers, their own is still working and it has destroyed our own vaccine, then we will give at 15 months. At least one of those two will work. It's because of this kind of issue that we have to start giving measles 1 and measles 2. So that is what happened. So, but all the same, it's still good for you to take the vaccine. And if your baby unfortunately has measles, it's still going to be mild. It's not going to be seriously severe measles. So don't worry about it. Okay, somebody saying, I just bought, where is the question? Is that disappear? Brought the drops of paracetamol for 6 months. So please stop buying paracetamol drops. Paracetamol drops is for newborns. After newborns, go and buy paracetamol proper one, the syrup one. Because all those people are giving is underdose. And that's why you will give it, your baby will still be having fever. Then you say, doctor, my baby is still having fever. Don't buy paracetamol drops for babies that are already above 2 months. The drops is for newborn babies. Everybody above that should take the normal. So post it on our Facebook group. So if you have any question beyond now, go to our ATP Facebook group. Unfortunately, we don't do that on Instagram. You can't do Instagram because our Instagram is managed by people who are not medical doctors. We have our social media managers. So, but our Facebook group is where you can have a back and forth Q&A with a pediatrician with professionals. So please, any questions beyond here, it has to come to our Facebook groups, and we can answer them. My baby has been coughing, her running nose for a month. You have to go to the hospital now. A month is too long. Go to the hospital. Okay, final question. Thank you so much. All right, thank you so much, everybody. I think I've answered all the questions. If you still have questions, time has gone. Please post it on our Facebook group. We will answer your question from Mondays to Saturday, every 24 hours a day. We only take a break on Sunday. Please give us up to 72 hours to answer your questions. We can answer your question. We try to answer it in 24 hours, but just in case. But if you want to have your immediate answers, you have to go to our ATP clinics. You can have a chat, you can have a consultation, you can have that, but you pay for that. It is premium service. For first-time mothers, we have our first-time mom WhatsApp group, because we know you always have questions like constantly. You have a first-time mom WhatsApp group. It runs for 3 months cycle. We have a current group running now that started in March. So feel free to join the WhatsApp group. Send us a message on our WhatsApp number. It is not free. It is 20,000 naira, but it is a 12 weeks intensive course, and you have a manual. You have access to me answering your questions per second as they are coming. So you can join that, or you can just buy the FTM manual of the FTM FAQ or the whole course, anyone that works for you, just for you to know how to support your babies. And like I said, this program has been brought to you by Ask the Pediatricians Foundation, and we are committed to the well-being of all children and reducing preventable deaths. We are currently about to go for our May outreaches, so if you want to support us, you can support us by donating money. You can volunteer for us. You can link us with organization. If you're a corporate organization and you want to collaborate with us, we welcome you. So thank you so much for supporting our mission of seeing deaths due to preventable causes becoming zero globally. So in line with SDGs 3. So thank you so much for watching me. Thank you so much. If you have questions, again, send it to our Facebook group and we will answer them. And you can also listen to my podcast on Spotify, on Google Podcasts, on many of the podcast platforms. It is Ask Dr. Gbemi ATP. Just subscribe, follow. You can also watch all these videos on YouTube. No adverts uninterrupted. So thank you so much, and it is bye from me. I'll see you again next week. And for those who want to join us on Thursday, we have a group discussion, and I will be taking that as well. And we're going to be talking about myths. So join our Facebook group, and you can learn more about myths in children's health. All right, I've talked enough. Bye, everybody, and see you again next time.